Once diabetes is diagnosed, taking oral medication or insulin injection or both together are the current norm for diabetic treatment. But my treatment experiences are different. With the clinically supported lifestyle correction for type 2 diabetes, insulin injections and oral diabetes medications can be stopped on the first day itself. Let us see how a 26-year-old diabetic patient taking 4 insulin injections daily from 18 years onwards, thus for the last 8 years, but not able to control blood glucose level and HbA1c is 9.5, was able to come out of insulin injection on the first day itself and able to get blood sugar control within a day and bring down HbA1c from 9.5 to 7.3 within a month, and by 4 months bring down HbA1c to 4.8. That means not only freedom from insulin dependence but also diabetes, a disease which can damage all the organs and cells in the body. Now let us see the patient details. Age 26 years, gender male, height 175 centimeters, weight 85 kg. When we come to the medical history, he was diagnosed with diabetes at the age of 18 years in 2014. From that day onwards, taking insulin injections daily, one morning, one noon, and 2 injections at the evening. Next, the surgical history, he had fracture history 2 times. It is first in 2019 he had a fracture, and again in 2022 another fracture. And also he had undergone operation for the breast enlargement, that is male breast enlargement, usually called gynecomastia, in 2021. Next, when we come to the family history, father was diabetic and died of cancer in 2013. Mother having hypertension and arthritis, and she is on medication. Next is a primary diagnosis or initial diagnosis is a type 1 diabetes, because the diagnosed at an younger age and taking 4 times insulin. So we take it generally as a type 1 diabetes. And then what are his problems when he comes, what are the problems actually? The day 1, the patient status when we see, he had the problems, the symptoms was sweating of the hand and feet. That was one of the major symptoms. And also stinging sensation on the hand and feet, especially the sole and the palm. And that was disturbing him actually. And also sneezing and allergic reactions. It was severe sneezing was there. And also frequent headache. That are, even though he's on this medication and he's having these symptoms also. And he was taking insulin aspart 40 units morning, 10 noon and 8 at the evening, and according to the food also he is adjusting because the blood sugar control is not there. So he is increasing the dose. The doctor was advised to take this, and if the sugar goes up, he can take more insulin dose. That is the advice given to him. And another insulin is insulin diantisora, that is called insulin glargine, that he is taking 24 units or more than that according to the sugar level. And when we come to the blood report, even with this insulin, he is increasing the dose and all, but his HbA1c was 9.5 and blood sugar was 232. And insulin level also is high. It is 66. With this insulin level, with this glucose level, the insulin level is this high, means there is type 2, there is a insulin resistance is there, and C-peptide is normal, that is 1.9 is there. That means this is a type 2 diabetes, it's not type 1 diabetes. A person who is having insulin high and also insulin value doesn't give, cannot be taken as such, because he is taking external insulin injections also. So the C-peptide level is more accurate for finding out whether it is a type 1 or type 2 diabetes. And C-peptide within normal limit, that means it is type 2 diabetes. Next is his lipid profile, that is cholesterol and triglyceride is very high. And vitamin D deficiency is there. Urea, renal function, urea and microalbumin, urinary microalbumin is positive. That means his kidney is already affected because of the diabetes. And his CRP and HSCRP is high. That is an inflammatory marker. This HSCRP is a marker of the blood vessel inflammation. That is a cardiac marker. So, because the HSCRP level is high, there is a chance for heart attack and problems can come. And in the liver function test, the protein level is high. 8.77 is the serum total protein is high also. Next is body parameters. When we come to the body parameters, weight is 85 kg and his height is 175 centimeters. So, he's overweight. BMI is 27.6 and BP also is high, 140/100. His hypertension also developed. And his abdominal or waist circumference is 98 centimeters. That is also high. He is having abdominal obesity also is there. And body age, he is only 26 years, but his body age is 47. So, almost 21 years plus accelerated aging is there. And the fat percentage is 30.3%. Ideally, at this age, fat percentage should be 10 to 15%. So, almost more than double fat is there in his body. With this, after the investigation report, that is the final diagnosis is type 2 diabetes, and he is having diabetic neuropathy, nerves are affected and kidney is affected, nephropathy is there, and the vasculopathy. That is also one of the reasons for this discomforts, and heart may be also affected, and obesity is there, hypertension and dyslipidemia, that cholesterol is high, allergic rhinitis is there, and migraine also, and vitamin D deficiency. So many problems are there already. Next, after the investigation, what is the final diagnosis? This patient is not type 1 diabetes, it is type 2 diabetes. So, the chance of getting freedom from insulin is high for this patient. And so he is having already diabetic neuropathy, nephropathy, the kidney is affected, blood vessels are affected, heart blood vessels is also affected. So, coronary artery disease can be there, and obesity is there, hypertension is there, dyslipidemia, that is cholesterol and triglyceride is high, and allergic rhinitis and migraine is there, and vitamin D deficiency. And when we come to the disease category, this is metabolic syndrome as well, the first diagnosis, then the allergy is there, and also probably an autoimmune factor because insulin resistance also is there. Next, when we come to the clinically supported lifestyle correction, what is done in clinically supported lifestyle correction? That is to ensure optimal nutrition and reduce toxins. So, nutrition should be there and the toxins should be less, because our body is made of nutrients. So, all the nutrition should be there, and the toxins, that is anything other than a nutrient is considered, body is considered as a toxin. So, avoid all the toxin, as much as possible reduce the toxin entering the body, and give optimal activities. The purpose of the body is to do activities. So, we should be, the body's activities, mental and physical activities should be also in an optimal level. To correct that, that is the aim of the clinically supported lifestyle correction. When we start the clinically supported lifestyle correction for the type 2 diabetes patient, all the diabetic medicines will be stopped at the beginning itself, because we will be using a low calorie carbohydrate diet, and the diet itself will be increasing the insulin sensitivity. So, if you continue with the diabetic medicines, there is a possibility, definitely not only the possibility, the patient can go into hypoglycemia. We stop all the diabetic medicines when the starting of the treatment itself. And other medicines, like if this patient is not on BP medicine, but if the patient is only taking BP medicine or statin or some other medicines, that will be reduced or tapered off according to the symptomatic relief and also the blood report, with the changes in the blood report. The diabetic medicines, insulin and all, we can stop immediately, and there is nothing to worry about stopping, because after 2 hours itself you can check the blood sugar at home itself. And after stopping this, we will be checking the blood sugar at home, and we can see the changes coming down. And now see what are the changes he had after starting with the clinically supported lifestyle correction. When we come to the symptomatic relief, actually by the 8th day itself, actually after starting 1 week after that, on the 8th day we'll be having a review, and that time itself the sweating and the stinging sensation, that's neuropathic symptoms, was reduced around 50%. And by 15th day it's almost gone, almost 80% gone. By 30th day these neuropathic symptoms were gone actually, and the sneezing and allergic symptoms he was relieved of it by the 8th day itself, and the headaches also gone. So most probably the sneezing and this allergy is because of the insulin, because it's this insulin analogs, especially this insulin aspart, has a side effect like that. And also the reason for the frequent headache is maybe the fluctuation of the blood sugar level, because on the insulin, that's very common for the diabetic patient. When it is going up and down frequent, brain find it difficult to adjust. Next, the insulin was stopped in the first day itself. So when we come for the 8th day review, no medicine is there, and he's almost symptom free. Next, when we come to the blood report, HbA1c was initially it was 9.5. On the 8th day it is 8.8, and 15th day it is 8.3, and 30th day it is 7.3. And by 120 days, his HbA1c came down to 4.8. So it is very uncommon. Usually, the people will be struggling to make it at least below 8. So within 120 days, actually 120 days is the replacement time of the RBCs, red blood cells. That is the time ideally needed for the correction of the HbA1c. So usually that is why the HbA1c is checked only in 3 to 4 months. But for this clinically supported lifestyle correction, we check every week, because we are expecting to this RBCs also, when you are giving optimal nutrition and the exercise, this RBC is also replaced very fast, because they are all damaged. This RBC, 9.5% of the red blood cells are damaged. So the body, if they get correct nutrition, it will be replaced fast. That is why he got such a fast result. Then blood sugar, when we start, if it is they are starting in the morning 8 o'clock, we check the blood sugar after 2 hours itself. Actually, it has started coming down in the first day evening. Within 12 hours itself, he got the blood sugar control without insulin. And when he came for the 8th day checkup, it was only 91. And the 15th day, it is 120. It's all after food. We take in the random blood sugar. We don't ask come for the fasting, come after fasting. So random blood sugar was 120. And 30th day, it is 89. And 120 days, it is 91. And the insulin level, that is very high initially. That is because of the insulin resistance. And insulin level came down to 6.5 by the 15th day, that is the second week. Next, about the lipid profile, the cholesterol and triglyceride came down in the 15th day, 8th day itself, and it's almost normal by the 15th day, and it totally normal after that. 30th day and 120 days, it's perfectly normal. And vitamin D, we checked only the second week, and it is came down to normal. That is why supplements also have given. And about the blood urea and microalbumin, that is renal parameters has come normalized within a week itself. 8th day itself it is normal. And HSCRP and CRP came down. HSCRP, because it's a cardiac marker, we checked in the 8th day itself and it is came down. And by the 15th day, HSCRP and CRP is normal. That the inflammatory markers has come down to normal. And the protein, the liver function test, the protein also came down to normal by the 15th day itself. So almost within 15 days is all the parameters are came to normal. That is the most important. This is you should remember that it's a patient who was on diabetic 4 times insulin for the last 8 years, and within 15 days of the HbA1c and sugar was not controlled, but everything is controlled. The blood sugar is controlled within 24 hours itself. Next, about the body parameters. When we come to the body parameters, when his height is 175 centimeters and weight is 85 kg. He's overweight and BMI is 27.6. Ideally for the Indians, the BMI is ideal is around 21 to 23. Maximum is 23 actually. And when we come to the weight, actually it is in the 8th day it is come down to 83, and by the 15th day it is come down to 82, and by 30th day 80, and by 120 days he's come down his weight to 69 kg and BMI from 27.6 to 23. And BP, actually he was not taking BP medicine, but his BP was 140/100, and without any medicine his BP came down to 130/90 on the 8th day and by 120/80 by 15th day. After that it was constantly maintained 120/80, 170, etc. Actually this BP also we are checking at home also. They will be giving a follow-up also with the recording, home recording also. So there also it was totally controlled. When we come to the waist circumference, that is abdominal circumference, it was 98 centimeters was initially and came down to 93 by the 30th day, and 120 day it is 84. Then the body age, he's only 26 years is biological age or the calendar age, but his initial body age was 47, that is 21 years plus, and it came down to 43 by 30 days and 25 by the end of 120 days. That is now he is actually 1 year minus. Is really 26 years, and originally when starting it is 47, and now he is able to come down to 25 years. That is younger than what is the real self. And fat percentage also reduced from 30.3% to 18% by the end of 4 months. Next we will see we'll just summarize what are the changes in the before starting clinically supported lifestyle correction and after the clinically supported lifestyle correction. Initially he was on injection 4 times daily and discomforts was there, but by the end there is no injection, no discomforts, no other diabetic tablet or anything is there. And next is when we come to the HbA1c, starting it is 9.5, the end of 120 days it is 4.8. And insulin level, blood sugar was 232, 91. Insulin level 66, 6.52. And C-peptide was 1.9. We don't really use, if it is normal, we don't recheck the insulin and C-peptide level because it is normal. And the cholesterol is reduced, dyslipidemia corrected without medicine, and the vitamin D was corrected, that is with the supplements actually. And the renal function abnormalities corrected, liver function abnormalities corrected. And when we come to the weight, actually 85 kg, to 69 kg after. And we are actually, future what we are expecting him to maintain at between 65 and 70. He has to come down little more or increase his muscle mass, decrease his fat mass and increasing the muscle mass. That is what is our goal is that. BMI was initially 27.6 and came down to 23, and to keep the BMI between 21 and 23 is ideal for the Indians. Then BP, it was 140/100 to came down to 110/70 and maintained that in the future also. And waist circumference is 98 centimeters and came down to 84. And ideal for him will be around keeping it around 75 centimeters. And body age, definitely keeping it 1 or 2 years below. It is always keep the body age around 25. That is the peak time for everyone's life. The muscle mass is peak. So he can bring up, he's actually 1 or 2 years younger. He can keep his body age 24, 23, 24. That will be the ideal. And the fat percentage, he should, it was 30.3 initially, now came down to 18. But by 128 or in the future, he has to keep it between 10 to 15%. That is the ideal for health in a healthy male. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicine and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolie Thompson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. To know more about this clinically supported and supervised lifestyle correction, you may search our website and YouTube playlist. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans, but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease, and come out of medications to protect our children, grandchildren, and the coming generations from the ill effects of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle disease and minimizing medication is the need of the hour. Thank you.